All right, we might get started, everybody. Thanks so much for joining us this evening. I hope you've all kind of had a lovely day. We've got both Hannah and I presenting, so we'll kind of be switching between screens and things, and it's all obviously a learning curve for us too, so thanks for being patient with us as we go along. Obviously, the reason that we're all here tonight is to talk about managing osteoarthritis and how we can really be the best version of ourselves while managing this condition as well. So we're going to cover a number of different topics. I'm going to go into the depth on the framework in just a moment, but you can see it's, covering a few different things like myth busting for osteoarthritis, looking at exercise, nutritional considerations, and then also some alternative sleep and stress management considerations as well. Okay. So the people presenting today, we've got myself, Tamika, Hassum, and Hannah Bain. You'll also see on the screen there. Thanks, Hannah. So we're both exercise physiologists here at True North Wellness. I think we know most of you that are on the call tonight as well. And really, we work a lot all the time with osteoarthritis. It's something that we're both really managing as well. Okay. Now, what I will do before we move forwards in the presentation, if we can just get everybody to pop themselves on mute, so there's no background noise, and sometimes it can get a little bit echoey. You can choose whether you have your camera on or not. It's nice to see the faces of the people that we're talking to, of course, as well. But if you have any troubles getting yourself on mute, just let us know as we go as well. Okay, but first, we want to hear a little bit about you guys as well, because that's obviously why we're doing this talk tonight. So you'll find in Zoom, I think we've all kind of had a bit of a crack at Zoom up till now. So we just pop in the chat whether you have osteoarthritis, and if you do, which joints you might have the osteoarthritis in, and then what you're most interested in with regards to the talk tonight. So we'll just give everyone a moment just to start typing that in there. But that gives us a little bit more information so we can kind of tailor things to you guys as well. If you just want to go to either the top or the bottom of your screen where it says the chat little bubble there.
Now, oh, gosh.
I'm trying to do something here else. I'm on a Zoom call.
While we're doing that, we'll just get everybody to pop themselves on mute as they go, and then we'll get into the chat a little bit more. But please, as I'm talking, please pop down whether you have osteoarthritis and what joints that might be in, or what you're actually most interested in for tonight as well. Okay.
Like the bones, pain in my bones.
Anna, since you're the leader of this, can I just get you to put everyone on mute if that's okay? Yeah, thank you. Beautiful. We're tag teaming it a little bit tonight, team. Okay, so this is really the framework as to what we're talking about tonight. So we're looking at a 5-step approach to osteoarthritis management. And you'll see we'll kind of touch base on each of these 5 points here. Number 1 being proactive and becoming informed. Number 2, looking at the movement component of things. Number 3 is nourishing yourself, and that's related to nutrition as well. And then we've got number 4 is prioritizing sleep, and number 5 is managing stress as well. So we're going to go into depth on a little bit of that. But step 1 is obviously being proactive and not reactive as well. So which you all obviously are by being on this talk here this evening as well. Some of the ways we can do that is by actually getting a diagnosis and then looking at how we can either prevent osteoarthritis or manage osteoarthritis if we already have it as well. And then obviously being informed is finding good quality information to educate yourself about your own health so that you can be actively involved in your health. And that's something that we're really passionate about, and why we're going to go into a little bit more detail in a moment on that stuff there. I did just want to take a moment to introduce this kind of model concept, because it is a lot of the way that we're going to approach things tonight, and just generally the way that we approach things at True North as well. So this biopsychosocial model is revolutionizing the way that we practice healthcare. It essentially suggests that in order to understand someone's medical condition, it's not simply the biological factors that we have to consider. And you'll see there's our 3 different components. So we've got the biological, which is often the one I think we think about. We've got the social, which is those interpersonal factors, and also the psychological. So we actually need all 3 of these to be working collaboratively together in order to give somebody the best outcome of this. So because of this, when we cover the physiology of osteoarthritis and the role that exercise plays, well, that's why we're also talking about these other factors such as nutrition and sleep and stress, which are probably the ones that we don't so much think about when it comes to this. But it's really looking at that kind of holistic approach here as well. Okay, I'm going to flip over. I'm going to stop sharing my screen. I'm going to pass it over to Hannah, and she's going to take over for a little bit here, starting with what is osteoarthritis. Thanks to everybody who's popping things in the chat as well.
Sorry, everyone, just bear with me. I'm just getting the presentation up for us. Okay, so looking at what osteoarthritis is, we also commonly refer to it as OA, as you've probably heard. So it's the most common type of arthritis, with 50% of the population ages 65 and older experiencing it. So that's quite a large population there. So in terms of the condition itself, it affects our whole joint, so our bones, muscles, tendons and ligaments there as well. And the most common joints that we do find the arthritis is in the hips, knees, feet and ankles as well. So that obviously can be experienced in a lot of other joints as well, but they are the most common ones that we do find. So when we have arthritis, we often find that we can have persistent pain and problems moving the joint as well, but this can vary between individuals. Another really important thing to consider with our arthritis is we previously sort of believed that the condition was a result of wear and tear, but there's now strong evidence to suggest that it's a changeable condition that can be influenced by physical, lifestyle, and psychological factors. So really this means that our health habits, so whether this be our amount of exercise or lack of, our sleep, smoking or excessive alcohol intake can all influence upon this condition, in addition to like our psychological and emotional factors. So if we have any negative beliefs about moving our joint, or some anxiety and depression as well, this can all influence our arthritis. Another really important thing to consider with our arthritis is a diagnosis does not generally require imaging. So we've found that pain doesn't correlate well with the images that we do get from a scan. So it's really important that we therefore treat our arthritis based on the problems that the individual is experiencing rather than how it's looking on the scan. Okay, so there's three really main points that I wanted to go through and break down for us today regarding our osteoarthritis. So number one, the pain you experience as a result of your condition. Oh, sorry guys. Just go back. As a result of your condition is not an accurate measure of wear and tear or any harm that you are doing whilst being active. So all this is really sort of trying to explain to us is that when we're experiencing any discomfort, we're not making the condition worse or causing any harm. So it's okay to have some mild discomfort when exercising, as long as this is settles down, the following day, then we can make sure we're making progress. Obviously, any major increase in pain or swelling is something we don't want, so we can start to adjust our exercise if that is the case. Number two there, flare-ups are an expected part of the condition and does not mean that OA is worsening in severity. So very similar to what I sort of discussed there. We are expected to have flare-ups, and that's just a process of the condition. So instead, when we're having this flare-up, which usually means a little bit of inflammation in the joint, we need to back off our intensity and volume of exercise until this starts to settle down. Number three there, how your joint looks on a scan and how it feels to you are likely to be very different. Now, this is a really big important one. So studies have shown that scans don't correlate well with our pain and the severity of our disease. So there's been some studies that have shown that people with really severe osteoarthritis, their scans showed that it was quite mild. I'll reword this for us. So those with quite severe osteoarthritis which was found on their scan, were only experiencing quite mild pain, whereas some with mild pain some with severe pain, only had quite mild osteoarthritis. So all that's really trying to say is that our scan isn't the best way to treat our arthritis there. And we want to look at not trying to become fearful of movement because our scan has told us that we have severe arthritis. Yeah, so it's really just coming down to how your joint feels and sort of using that as a measure when we're exercising. Okay, so exercise is something that is a major treatment and is known throughout our clinical guidelines for managing osteoarthritis. And the really good thing is that it's just as effective as pain medication and has safer and fewer side effects as well. So some of the other benefits you can see there down below. Exercise reduces pain. It increases muscle strength to support and stabilize affected joints, improves joint movement and flexibility, improves our balance, helps us to lose weight or maintain a healthy weight to reduce the load on our joints, prevents deconditioning, improves our ability to complete daily tasks, and improves our overall well-being, sleep, and mood as well. Okay, so now that we sort of have an understanding of what our arthritis is, we want to go into what type of exercise is really important for managing our arthritis. So the first one that we really recommend is our strength exercise. So this is really important for building up the strength of the muscles around the affected joint. And this therefore takes the pressure off the joint as well. It's also been shown to improve feelings of giving way and improve our balance as well. So we can do strength exercise at home or in the gym with some weights, some resistance bands, or just our body weight as well. So this can include anything like some step ups or some sit to stands are some really good examples. Another type of exercise that we should be aiming for to help manage our arthritis is our aerobic exercise. So this is anything that makes you breathe harder and raise your heart rate as well. And it's also going to help us sleep better, assist with our weight management, and increase our energy levels and general health. So it's a really big one for reducing our risk of chronic disease. The really good thing as well with our aerobic exercise is it's been found to release pain relieving hormones called endorphins, which is super important when we're managing our arthritis. So examples of our aerobic exercise could be things like swimming, cycling, or walking. Okay, so we're moving on to some water-based exercise now. We also tend to call this hydrotherapy. So this can become really helpful if we're overweight or we have quite severe pain or disease progression with our osteoarthritis, or you can also just enjoy being in the water as well. So this is because the buoyancy provided by the water reduces the load on our joints. So it says there in chest deep water, your legs only support 1/3 of your body weight. So that's quite a big difference there. So you can see that it can really help you to either build up your exercise capacity and help you build into land-based exercise if your joints are preventing you from doing that currently. So our hydrotherapy pools are generally heated at about 34 degrees, and that's been shown to have some pain management effects, so helping with that pain management and keeping our muscles nice and warm and loose as well. That's not to say that you can't try using a normal pool, which is usually a little bit cooler. So it's all about what works for you as well. Okay. And of course, the best exercise is the one that you are going to do as well. So making sure that whatever you're doing, you're enjoying it. And that way we can make sure that we're doing the best that we can for our body and having a good time at the same time. I'm just going to add someone into the chat. Sorry, just bear with me. Yeah. Okay. Okay, so this is just a bit of a take-home slide for us to think about the physical activity that we're doing. Hi everyone, to those who just joined. We're just going to mute our microphone if that's okay. Okay, so with our physical activity, I'll just mute that one. This is anything that gets your body moving and your heart rate going a little bit faster as well. So we can have what's called incidental activity, and this is the physical activity that you might undertake in your day-to-day life. So whether you're doing some gardening, housework and things like that. Whereas our exercise is our structured, planned physical activity. So really all we're trying to say here is it's great to have a combination of your incidental activity and exercise. So just trying to make sure you're including some planned exercise as well. Another thing to consider with our osteoarthritis is unfortunately, we do find there's increased levels of sedentary behaviour due to our pain and things like that. So really we want to try and reduce our sedentary behaviour or our sitting and lying down for as much as we can, just to help with our overall health and movement in our joints too. So ways that we can do this at home may include taking the stairs instead of like an elevator if you're out, or parking a little bit farther away from wherever you're trying to go so that you can walk a bit more, or standing up and doing some things in the middle of TV ads as well. Okay. So looking at how much physical activity we need to do. So our overall guidelines are 150 minutes a week of moderate intensity aerobic exercise. So this is anything that gets your heart beating faster. And we can usually talk with some moderate intensity exercise. Obviously moving to vigorous exercise, we don't need to do as less. So the recommendation is 75 minutes of vigorous exercise per week. And this is where you're huffing and puffing and probably can't talk. So things like running would definitely be a vigorous exercise there. Our other guideline is our muscle strengthening exercise. So we're also recommended to do this for 2 days in the week. And this is really important again for taking the load off our joints, improving our balance and reducing our falls risk, and improving our ability to do everyday tasks like sitting and standing and walking upstairs. So you can see down the bottom there, start with just 5 minutes, it all adds up. So we never, if we're nowhere near reaching those guidelines, that's totally okay. What we want to do is start to build up and start nice and slowly to reduce our risk of flare-ups there. Okay, so that moves us in nicely to activity pacing. So this is all really about trying to increase our exercise levels safely so that we aren't increasing our risk of a flare-up, sorry. So there's a concept called progressive overload, and this just basically means that we start your exercise routine nice and slowly, and we gradually increase and progress your exercise targets along the way. So this allows your body's tissues to adapt so that we're not giving it a nice big shock and increasing the risk of a flare-up. So over time, as you get used to your exercise, you'll be able to do this less and less. However, you should always listen to your body and how it's feeling. Okay, so another thing that's really good to consider whilst managing our arthritis is our diet and nutrition. So what we really want to do for this one is eat a balanced diet. That's really the best thing you can do. So eating diet rich in plants, so trying to have a variety of colors with your fruit and vegetables. Fiber, so this can be vegetables, fruit, nuts, seeds, grains, and healthy fats as well, so fish, avocado, or olive oil. So this is because these provide an anti-inflammatory response to your body and help with the weight management, which we want for our arthritis. So a way that we can do that is through the Mediterranean diet. So this is just eating really a pattern rich in whole foods, including vegetables, fruit, fish, nuts, legumes, and whole grains. So when it comes to eating these type of foods, we're reducing the foods that are saturated in fat, sugars, and salt, and therefore reducing the inflammation in our body. Okay. So obviously we don't expect you to change your entire diet, and just making small changes along the way to try and achieve those things is a great starting point. So we have the 80-20 rule there that you can see up on the slide. And basically that just means that we can try and have about 80% of our diet working towards those goals and allowing room for that 20% of foods that might not be ideal, or those unhealthy foods. So this means that we're able to sustain this diet for a long period of time. Whereas if we were to go cold turkey and take out all of our unhealthy foods straight away, probably find it's a lot harder to maintain over time. So you can see below there some examples of some small changes we can make to our diet to help with our arthritis and reducing the inflammation in our body. So you can try some high fiber crackers and bread, trying to have lots of visible grains and seeds, eating a rainbow, so lots of different colors of your vegetables and fruits. Focus on your healthy fats, such as using olive oil or avocado. Aiming for 2 serves of fish per week if you like fish, or adding a small can of your favorite lentils or legumes to your cooked meals as well. Okay, so I also wanted to touch on our weight management for our arthritis. Now, this isn't like the be all end all, but it's definitely a really important thing that we need to consider here. And this is because they found that having an obese BMI or being overweight is a really big risk factor for developing osteoarthritis. So they found that you're 2 times more likely to develop knee arthritis if you were overweight. So that's a really big sort of comparison there. So the reasons for this, they found that they can either be mechanical or systemic. So when we're referring to mechanical, we found that every 1 kilogram of body weight leads to a reduction of up to 4 kilograms of pressure in your knee joint. So that's quite a lot there. So you can imagine how losing some weight might help your joints feel a little bit better. And then the systemic factors is a little bit of a different one. So they did also find that being overweight increase the risk of getting hand arthritis, and our hands aren't a weight-bearing joint. So they had a bit more of a look into that, and they found that the lipids and body fat throughout our body can generate some inflammation. And because our osteoarthritis is flared up by inflammation and our symptoms can increase, that's another reason why reducing our body weight and therefore our body fat and lipids can be very helpful. Okay, so I'm going to move on to Tamika now. I'll just finish sharing my screen.
All right, thanks, Hannah. No, you've given us lots of awesome points to consider there. I'm just going to bear with me for a moment. I'll just get my screen share up. Doesn't seem to want to. Let's try again. Okay, I'm thinking everybody can see that. Is that correct? Yep. Give me a thumbs up, Hannah, if you can see that. Yeah, okay, perfect. Thank you. So I'm just going to move through to where we're up to. And we've talked a little bit about kind of our previous steps in terms of exercise and nutrition and that weight management side of things. But now I just want to touch a little bit on sleep and stress. So if we're looking at sleep, it's a really important fact. Well, we know if we're in pain, we're less likely to sleep well. But what we don't often consider is that when we don't sleep well, it actually contributes to our pain as well. And that's why it's a really important consideration for osteoarthritis. So we know that at least 60% of pain patients actually suffer from sleep impairments, but we also know that 50% of patients with insomnia have chronic pain as well. And because osteoarthritis is largely driven through this pain cycle, that's an important consideration too. So when we look at exactly how this does that as well, so you might have heard of the lymphatic system, which kind of helps our body kind of clear out waste. And that's where we get the term of lymph nodes and that sort of thing. Well, we also have waste build up in our brain, but that's a slightly different system called our glymphatic system that helps to clear that out as well. Now, that glymphatic system needs about 7 to 9 hours in order to actually get rid of all that metabolic waste in our bodies as well. So that's why we need that deep restorative good length of time for our sleep as well, or we end up with that metabolic waste still sitting in our brains as well. And again, it links to the weight management side of things. We know that if research shows that within 5 to 6 hours of sleep per night, there's even a significant increase in the hormone that makes us feel hungry and a drop in the hormone that makes us feel full. So with that amount of sleep, you're also more likely to eat 500 to 600 more calories per day, which when we think about those things, that makes it very hard to maintain a healthy weight when we're just naturally feeling like we need some of those more sugary sort of foods as well. So when we look at some tips to improve sleep, so there's a lot of research backing this up now for pain management. There's a term called sleep hygiene, which means you're basically setting yourself up with good, healthy habits that promote consistent, uninterrupted sleep as well. So when we look at these 9 things that we can do, number 1, regularity is key. So it may sound nice and straightforward, but getting to bed and waking up at the same time each day, even on the weekends, and trying to avoid naps during the day allows our body to get into that nice regular sleep clock as well. So also establishing a wind down routine. So think of an activity that kind of makes you feel like you're settling down, and strategically doing that before bed will make your body feel more ready for bed when you get there. Reducing blue light in the evenings, but also getting some good morning light to kind of kickstart that cycle as well. And then we're looking at exercise, which is probably the last thing we think about with sleep, but it's the most important thing for helping to manage our energy levels as well. Considering that bed is for sleep and sex only, so that means that our body associates being in the bed with either of those things. It doesn't associate it with laying there on our phones or replying to emails or any of that sort of thing. Also, considering the room temperature, we do need a cool temperature in order to get quality sleep, and limiting other stimulants as well with that too. And then just touching a little bit on stress as well. And there's actually, we talked about with pain and sleep before having a bidirectional relationship. The exact same thing happens with pain and stress as well. So we've got a system called our autonomic nervous system, which regulates our automatic processes. So it means the things that we do subconsciously. So things like breathing, digestion, that sort of thing. So this can be broken down into our our sympathetic nervous system and our parasympathetic nervous system. So the sympathetic nervous system is kind of our fight or flight response, which is that kind of red zone at the top there. And the parasympathetic is our rest and digest. So we need kind of this healthy balance of this as well. But when we don't have that healthy balance and we spend too much time in the red zone, that actually increases the inflammation and stress in our bodies as well. So when it's endured for a long period of time, it becomes really problematic to our bodies and contributes to the inflammation that we've talked about as well. So we don't want to be constantly in that fight or flight mode. So the balance is in the key. So think about the sympathetic nervous system as that gas pedal and the parasympathetic nervous system as that brake pedal. So we need to have that kind of nice balance with what we do there as well. Some strategies in order to manage stress. We hear the words mindfulness and meditation. I could talk about them all day as well, but knowing that it doesn't have to be a formal kind of sit down with your legs crossed kind of thing. We can do some, formal breathing exercises, but it's also about finding our flow state. And that's just when we're completely absorbed in what we're doing. It can be something like walking, even with that side of things too. So some strategies to manage our stress is to be proactive and recognize the signs. diaphragmatic breathing as well. So when we breathe right to the bottom of our ribs and get that expansion through the diaphragm, that is the only way we can consciously try and activate the parasympathetic nervous system. And again, we could talk about that all day as well, but also looking at adding joyful activities to your day. So that might be something that you strategically do in order to manage your osteoarthritis. So just getting you all kind of thinking outside the box a little bit there as well. So again, the mindfulness, whilst it can't directly, manage the osteoarthritis, it can help how you feel about the pain and your experience in life. And it allows an observation of the pain without getting too involved in it as well. And again, we know that chronic pain means chronic inflammation, which is that red zone, that fight or flight. And mindfulness can kind of help to reduce that inflammation and pain sensitivity as well. Okay, so that kind of brings it round with our 5 steps for managing osteoarthritis. And you can see how it's about so much more than just the movement side of things as well. We often think about that exercise, but we don't consider these other kind of multifaceted factors as well. And that's really what we focus on with our approach with osteoarthritis as well. So where to from here? So you might already be doing some of these things, which is fantastic. I did just want to point out we do have a Happy Joints program, which is for osteoarthritis. So it's a 4-week graded exercise program that really aims to help build your confidence with movement and exercise. So if that's something that you're interested in, if you're on a care plan, we can bulk bill that for you, but there's lots of different options around that. And if you refer to the information talk today, you can get a free resistance band to assist you with your home exercise as well. So please flick us an email afterwards if that's something that you'd like to know a little bit more about as well. Now, there's lots we could talk about. We could talk all day about osteoarthritis, but hopefully you've kind of picked up a tip or trick amongst all of that as well. Did anybody have any kind of questions about the content that we've covered today? You can either unmute yourself and talk or pop it in the chat. Now, if anybody does come up with any questions between now and then, we do have somebody in the chat here, I think. Can you read that out, Hannah, if that's okay? I can't seem to open it up. You're on mute, sorry.
Yeah, sorry, guys. So yeah, it just said thank you very much. That was really helpful. So I'm glad we could put some good thoughts into you and you got some benefit from it.
Beautiful. Any other questions for us today? Well, like I said, if any pop into your minds, you've got our emails we sent through that additional link with as well. And again, our apologies for the mix up with that. We're all, they say when you're young, you're meant to know how technology works, but I think Hannah and I can agree we're still learning as we go as well. So we have recorded this information session for today, so we'll automatically send that out to all of you. The other thing we'll send out is a little bit of a feedback form, so we can continue to kind of give you this information talks and make it about stuff that you actually want to learn about as well. Wonderful. Well, if nobody has any more questions, we might let you all get on to your evenings, but thanks so much for joining us tonight, everyone.
Thanks, everyone.
Thanks. See you later, guys.
Bye.